Let's talk about the bird flu for a bit. The numbers have been rising. They've been rising for months. It's got people worried about food safety, worried about egg prices, worried about the potential for person-to-person spread. And by the way, this iteration of the bird flu, H5N1, it's not new. It's been detected in a variety of bird populations since January of 2022. It's also not going anywhere. In March of last year, it was found in dairy cows for the first time. And since then, there have been nearly 70 human cases, mostly in dairy and poultry workers, including one fatality. So, yes, public health experts are saying that the risk to the general public is low, but this flu is pretty persistent. It's just not going away. As farmers have killed millions of chickens to help curb bird flu's spread, well, there are costs to all of us. The average price of a dozen eggs has almost doubled from around $2.50 a year ago to nearly $5 today. So, the consequences, we are feeling them at the grocery store. But there's also the health question. How worried should we be about whether the bird flu is becoming a wider threat to public health?
And we have a public health expert here, CBS News medical contributor, Dr. Celine Gounder. Dr. Gounder, good morning. So should people be concerned that we are on the verge of a bird flu pandemic similar to COVID?
I think to answer that question, Adriana, I think it might be helpful for people to understand how a bird flu pandemic might happen. So the bird flu can infect birds as well as mammals, which include pigs, cattle, and cats. People can get infected when they come into close contact with infected animals. So farm workers, for example, are at high risk for infection. At the same time, people can get infected with the regular human flu. And it's possible to get both at the same time, the human flu and the bird flu. When that happens, those flu strains, which are each made up of 8 pieces of genetic material, they can swap parts, making new hybrid strains. And those hybrid strains can be especially dangerous to humans, and these are the strains that we worry could spark a pandemic.
Okay, that was freaky to see how that could happen. I was like, are we watching a movie? Is this Outbreak?
I mean, it's kind of like Frankenstein, right?
Yeah.
Like you're swapping body parts.
So that's out there happening right now as we speak, and there's nothing we can do about it. Should we take precautions out here in the grocery store? Should we not be eating certain foods? Should we, I don't know, what should we do?
Well, this is why we learned to cook as humans hundreds of years ago, thousands of years ago. We learned that if you cook your food, your risk of getting infected with any number of things is reduced. It's much safer. You're less likely to get sick and die. Same thing with milk. We learned in the 1800s that pasteurizing, which means boiling your milk, you're not doing anything unnatural, also reduces your risk of any number of infectious diseases, including the bird flu.
Okay, so we can zap it if it's in there, but how can humans get bird flu? Is it just through other transmission from humans, from animals?
Yeah.
Like, what should normal folks what should everyday people be
70
thinking
people
about?
got it.
Yeah.
And they've gotten it from contact with animals. So far, it's been animal to human. Now, if you get one of those Frankenstein hybrid strains, that's when you worry that it could become human to human.
So there hasn't been human to human yet?
Not yet.
And they're getting it from animals because they got on their finger and they touched their eye or something, or are they getting it from an airborne particle?
They're farm workers. So they're coming into close contact. They work in the dairy industry. They have milk all over them because they're milking the cows. You know, they're working with poultry. So when they come into close contact like that, whether it's through breathing or contact with their hands, their eyes, et cetera, that's how they're getting it.
And they also detected bird flu in New York. In New York, they shut down a couple of locations. So this is really kind of starting to get everywhere. Is there any kind of vaccine or protection from this?
So the Strategic National Stockpile has a limited number of bird flu vaccine doses. The problem is those are not going to be a perfect match to what's circulating out there right now. In addition, under the prior administration, the federal government did contract with Moderna to develop some mRNA vaccines for this. The advantage of mRNA vaccines is they're much faster to produce, but those would need to go through clinical trials, FDA approval. People would actually need to take them. And under what Kennedy, who's been nominated as HHS secretary, likely to be confirmed, it seems, under what he has proposed, it would be much more difficult for the FDA to approve a vaccine. The bars would be set higher. He wants to put a pause on NIH research on infectious diseases for the next 8 years, which would mean that the funding to develop vaccines and treatments for bird flu would be more limited.
I mean, we were really not prepared for COVID. Is the U.S. government prepared for a potential bird flu outbreak?
Well, everyone needs to be playing their role. So that means industry, means government, it means scientists, and the general public. So, I already mentioned some of the things the federal government could or may not do in response to this. In terms of industry, it's an economic concern for them. So if they take certain measures, if they test that can have real economic impacts, there is a compensation program for poultry and dairy by the USDA. The dairy industry compensation program may need to be more generous to get people to come on board. You have farm workers who may not want to come forward to get tested because maybe it's their immigration status or they just don't want to lose their job. And then, the public, if we have a vaccine, need to get vaccinated or it won't work.
Yeah.
All right.
All right.
Dr. Gounder, lots to think about.
Thank you.
All right, but we can still eat our eggs if you can find them.
If you can cook them.
Yeah. Thank you so much.